Yes. Very, very, very good evening to all of you. And let's start our today's discussion, very important discussion about Kegel exercise. So many of you might be already working as a pelvic rehab therapist, experts. Might be some of you have get training from me directly through these workshops and webinars, and where I have already explained a lot of things about pelvic floor, detailed explanation about pelvic floor, the anatomy, physiology, the function, the dysfunction, the action, the then how to assess the muscles, how to treat the muscles, and you might have heard about in my workshop also the word Kegel. Sometimes I have done specific webinars on Kegels, how to do Kegel. But how to do Kegel, how to isolate the muscles, that's the one different term. But today our session is stop Kegel. So, in which cases we should not go for Kegel exercises? I'm going to give you that understanding from this today's webinar. I have not created a very fancy PPT for that because I wanted to give you some facts which is already visible on kind of Google. So I have some screenshots from the Google, so we can just go precisely what if a normal people, normal layman, and a normal physiotherapist, if they want to just understand pelvic floor dysfunction and which exercise I can do for pelvic floor dysfunctions. So what terms comes in? You might have heard about the Kegel exercises are very effective for urine leakage. So that is also another important understanding. Being a physio, being an expert in pelvic health, we should understand that urine leakage itself is a big term, and there are different types of urine leakage. So what Google is telling us, not only us as a physio, but the Google is telling to the community, to the society, and how the society is perceiving, and why, how they are doing it, and how these Kegel exercises are failed. So this is very important discussion we are going to do in this session today. So I will share my screen with all of you. And yes, before I start presenting my screen, I want to have understanding that how many of you are already practicing pelvic floor, and you have attended any course or any kind of webinar, any learning thing about the pelvic floor, and you are already helping your patient. So please send yes in the chat box that I'm already working. And if you're new, so please write down I'm new. So this is a new concept for all of whoever it is new concept. So that is going to give me clarity that how I should take my session. If you are very new, so I might have to give you some understanding what the pelvic floor muscles are. And if you are already practicing it, so you are familiar with the pelvic floor muscles, the layer, their functioning, their dysfunctioning, their assessment, and the treatment. You are already aware about that. Okay. So please write down in the chat box how many of you are already practicing that. Let me understand my audience. Yes, yes, new, new. Some girls they are new. Okay, new. Yes, yes. Some girls are new, 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 new. Okay. Yes. So it's a kind of mixed population we are having. So let me give you a very superficial over view of the pelvic floor. So I will not take much time because there are so many people who are already having a depth knowledge about this. But still, this is our pelvic bone, and we all understand this pelvic bone. At the floor of this pelvic bone, we have one important muscles. Skeletal muscle is lying, and the name of this muscle, which is covering the floor of it, is the we are calling it as a pelvic floor muscle. And by creating this floor, we can see there is a one cavity which is formed. So into this cavity, which is a kind of bowl shape, we have some important organs lying anterior to posterior. So very important organ, first organ which is available in both, present in both male and female, is the bladder. So that is the most anterior organ which is lying into the pelvic cavity. Then and this bladder is having urethra, and this urethra is coming out from this pelvic floor. So pelvic floor muscles are giving some space so urethra can come outside, and it is helping in performing all this bladder functioning. So whenever we want to pass the urine, the muscles will relax, and whenever we want to hold the urine, the muscles will contract. It means this closing and opening around this muscle, this urethra, is very important function of the pelvic floor, and this is where we are calling them as a sphincteric action of the pelvic floor. Sphincteric means completely circular action, sphincteric. So that is a great, you can feel my, you can see my fingers, how the way I'm squeezing if I want to hold urine, and if I want to pass urine, how I will relax. So muscles will relax during the urination, and it will squeeze during the holding. So that's way these muscles are performing and helping, very important in maintaining the bladder functioning. Same way, we have another organ in a female body. This is the blood. This is the uterus with vaginal canal. So you can see that uterus is present in the middle of this pelvic cavity. It's the middle organ, and that organ has a canal, and canal is also coming out from the pelvic floor muscles. It means pelvic floor muscles are giving space for this opening so it can come out. So every day, like we have seen this menstrual cycle going on, monthly cycle is there, and every day some kind of liquid is keep coming out from the vagina. So we need lubrication. We don't want any dryness into that, as per the hormonal effect into our reproductive system. And they during the periods also, we want this menstrual blood flow to come out. So that also comes out from the vagina. When the female want to have a sexual intercourse, the sexual penetration happens through the vagina. And when we want to get pregnant, the sperms enter from the vagina itself. So vagina is a very important part of reproductive system, and this vagina is also coming out from this pelvic floor orifice. I'm so sorry, I need to put my phone on silent. Okay. So it is very important functioning around that vaginal muscle, vaginal area, and that's how we are calling them, these muscles, as the vaginal muscles. So you can say that if I want to have periods coming out, okay, so we don't want too much of tension on that area. Otherwise, there will be always some kind of vulvar pain around the perineal body during even, which will be increased during that menstrual cycle. And same way, any female who wants to have intercourse, and not only intercourse, any palpation or any insertion inside the vagina, that insertion can be the insertion of menstrual cup, or it can be the insertion of tampons, or just a simple finger insertion during the gynecological examination. So if you want to insert your finger inside the vagina, at that time of at that time, we want these muscles to help us, and they should go for relaxation. So relax pelvic floor, so I can have a opening and I can insert my finger inside. If we cannot do that, you cannot insert the finger, you cannot insert the menstrual cup, or there's a difficulty in insertion of the tampon, or difficulty in having in the sexual penetration also, it means that orifice is somewhere tighten. So who is creating tightness around that vagina? So these are the muscles. So muscles can be tight, which will stop you to go inside the vagina. So this is again which can give you a lot of issues like vulvodynia is an issue. There might be vaginismus, like means vaginal muscle spasm. So means these muscles which is around the vagina, they will get spasm, or might be pain during the insertion, pain after the insertion. So we also call it as a dyspareunia, pain during sexual activities, or having pain after that sex means it might be levator ani spasm. So the muscles around the vagina might get tense. In this way, you will not be able to have insertion inside the vagina. So you can understand that can affect a female, normal life. It can affect the sexual life. It can even affect the fertility of a female, because if the penis insertion will not be there, not happening, so the sperm cannot enter. If the sperm will not be able to enter, so she will not get pregnant. So it can directly affect that. Fertility of any female. So very important that these muscles which is around the vagina, they should not be tight, and we want them to relax. And this, whenever it is required as per the functioning of a female. And the second thing is, it is also same time, it is also very important that I don't want that this support of this muscle is not there. So muscle has a strength. They have this kind of endurance all the time. We have this slow twitch muscle fiber action, fast twitch muscle fiber action into these muscles. So these muscles are providing a base of support, and this support is important to support that or these organs. It means the vagina which is coming outside, the organ should be supported. So if the muscle has a good tone, then it will only support that organ. Please mute yourself. Mute yourself. Right? So it's very important that muscle should be relaxed, and whenever it is required, and the muscle should be always having a maintained tone, good strength. So it can support the organs, it can support the vagina itself. If these muscles will be weak, so you can understand the vagina will be saggy vagina, and according to that, whatever content is there inside the vagina, it can be anterior wall, anterior side, bladder, urethra, it can be posterior rectum, it can be upper uterus or cervix. They can start coming outside, and we can term it as a pelvic organ prolapse. So means the supportive function of these pelvic muscles are not good. So means muscles are not strong enough, and the organs are falling outside. So we need a good strength, and this contractibility ability of these muscles, which can help in maintaining the good strength and good support to those organs which is lying into this cavity. So yes, it is important to have a better contraction, better strength, better power, better endurance, and it is simultaneously very important to have a better relaxation. Both properties are important, and the coordination according to the brain, the muscle should be able to react. So that coordination function is also very, very important. So we understand that how important these muscles are around the vagina. Same way, we have another last organ which is present most posteriorly, and that organ is the rectum. So rectum is collecting the stool from that large intestines, and you can say that rectum is having one canal, and this canal is passing through this pelvic floor. So now same way around this, because rectum is collecting the somewhere weighted material, which is the kind of feces. They have some weight, and we are all always doing this defecation once or twice a day, depending upon your food habit and your defecation habit. So it might be once or twice a day. We are not passing that throughout the day. So this activity, just to support that, the muscles around that, we are calling it them, we have there are different muscles around that area. Puborectalis muscle, that we have external anal sphincteric muscle. So you can understand the sphincteric muscle, I mean circular complete kind of grabbing of the anal area. So this kind of circulation, we call it as a sphincteric muscles, open and close. So now these muscles has a good tone, good strength. Good strength will have a good tone. Good tone will have a good endurance. That is helping all the time to maintain the continence of the stool inside the anus. So that is very very important, that yes, I want to hold my stool, so I have that strength throughout the day. My muscles are always maintaining the tone. So the puborectalis muscle is maintaining anorectal angle throughout the day, 24 hours. The time when you want to go for defecation, only that time these muscles go for relaxation and you pass that stool. Otherwise, after doing the defecation, again the muscles will pull the rectum anteriorly, and by maintaining this anorectal angle, 90-degree or 100-degree angle. So that is very very important functioning of this puborectalis muscle, which is a part of levator ani. And same way, the sphincteric muscle, the anal sphincteric muscles are maintaining the sphincteric action around the anus. So this any particle which might go down from the puborectalis muscle should not come outside, and we should not have this leaking of the stool or any liquid from this that area, anal area, or so that is very important. So this continence, maintaining this continence around that area. So this sphincteric action, squeezing action, is very very important. Not only the squeezing, even maintaining the squeeze throughout the day is very very important action of the pelvic floor. And also, not only this contraction ability is important, the simultaneously other hand, when I want to defecate, my muscle should be relaxed. So this is very important functioning, that I want to defecate, so muscles should not be over tight all the time. They should have this relaxation ability. So you can understand that these are the three important functions this muscle is doing, of which is helping in our all these organs which is situated into the pelvic cavity. So bladder health, urination or holding the urine, muscles are important. If you want to urinate, muscle should be relaxed. If you want to hold, the muscle should be having the strength to create a contraction. Same way around the vagina also, if you want to have a penetration inside the vagina, muscle should be relaxed. If you want to even pass something from the vagina, now what we have to pass from the vagina, so we need they should have a good strength all the time, so it can have a uh, holding capacity, supporting capacity, good tone, but it should also be relaxed during penetration. It should be relaxed during the childbirth, during when the baby is going to come outside. So muscles should have this capacity, that the muscle fibers, they should not have any tension around the vaginal orifice. It can be superficial muscles, bulbo, it can be the deeper muscles, urethrovaginal sphincters, it can be more inner pubovaginalis. These muscles around that should be relaxed completely. And even the around supporting muscles, the muscles which is going around the perineal body, they should also be having the relaxation. So you can understand that we need that muscle to have a good work to be done as per the requirement. Same way around that, so it is supporting our reproductive system. It is because I can get pregnant if the sperm will go inside. It helps into childbirth. I can have my baby out if the muscles are relaxed. So it helps in supporting the baby, this organs inside. Pelvic organ content will be there in their positions. So pelvic supporter, we are calling these muscles. So because vagina is a central muscle, center of gravity is also all the time going on through the perineal body. So it's very important to have a good muscles around the perineal body, good strong muscles around the perineal body, so we can have a good angles be created into that area. Same way, these muscles are helping in our sexual functioning, because during the sexual activities, these muscles are pulling the penis towards the clitoris, and female can have a good sensations during the orgasm and during that penetration and during the stimulation. So just to give a better stimulation to the clitoris, so that orgasm can happen. So muscles are very important for sexual functioning also. If the muscles are tight, you cannot have penetration. They might affect the couple life. Same way, these muscles are very 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 important for maintaining the anorectal functioning as well. So bladder health, sexual health, reproductive health, as well as our and like you can say bowel health, all are important, and the muscles is performing its action, and they should have a good strength of contraction, good tone, and good relaxation ability, and good coordination. Not only that, these muscles are all coming out from all the sides of the bones, so from pubic to coccyx, from ischium to pubic penile body. So muscles somewhere helping into stabilizing stability. They maintain the stability of the ischial tuberosities, back, coccyx, pubic symphysis. So muscles are important to have right you can say pelvis, right? Neutral pelvis in our body. We don't want the tight muscles will bring the structures closer. So in this case, when these muscles are very tight, so you can understand there will be narrowing of the outlet. So when the outlet is narrow, so inlet will increase and outlet will narrow. So you can understand there will be definitely issue with either defecation, either urination, either sexual activity, or some other stability, or might be back pain. So we don't want that kind of too much of grabbing from the down. Outlet should not be tight. And the same way, outlet should not be completely out from too much open outlet. So you can understand if the open outlet, so muscles will start getting saggy down. So when the muscles don't have stability, they don't have any tone, they don't have any strength, they will fail to maintain the stability between these ischial tuberosities. And you can say that they will start going away from each other. So that can give some kind of descent to the perineal body. So this is the importance so far of our these muscles in our body, pelvic floor. So yes, they are important for everything. They are important for urinal health, bladder. We are calling it as a bladder health, sexual health, stability, support, sphincteric action, and very important, we have so many veins into the area, into that area around the pelvic area, and we are calling them the pelvic veins. So these veins are, as we know, that blood supply, like venous return is very very important. So the good pelvic floor muscles keep creating a upward tone, and that tone helps into venous draining towards the heart. So that is the fifth function of this pelvic floor. We are calling it as a circulatory action. You might have heard about piles and hemorrhoids, which is affecting so many of the people. What is the piles or hemorrhoids? They are the protrusion or dilation of the pelvic veins from around the anus. So that is, you can understand why this is happening. That might happen due to the tight puborectalis muscle, or it can also be due to the weak external sphincters. So weak external anal sphincteric muscles. So muscles should have a good tone so they can help even in better venous pumping. So this is all the functioning of the pelvic floor, importance of the pelvic floor. If we say, so this is what we I'm telling you, you might be also aware about that through your learning yourself, learning your education from different workshops, webinars, different people. They are giving all this kind of nowadays pelvic floor is very loud, but today's webinar, when we are talking about stop Kegel. So what is this Kegel? So Kegel, if you just write down on the Google, which I have already done for you, let me just show you. Uh, I need to share my screen window, and this is Kegel. Can you see the screen, all of you? Visible?
Yes,
Yeah,
ma'am.
ma'am.
Okay, visible. So now today you understand the what is the pelvic floor now. Okay, and these muscles are no so many muscles layered into different. They are layered in three. They are like they are arranged into three layers: superficial, middle, and deeper. That is their functioning. This is how they are helping. And you might have heard about the word Kegel or reverse Kegel. So Kegels means creating the contraction, increasing the strength of the pelvic floor muscles. And like whenever you feel the muscles are not having tone and they are hypotonous muscles. So muscles can be hyper or it can be hypo. So whenever hyper term is means too much tight and too much tone is there. And when we call it as hypo, very lax, very loose muscles which is not able to provide the supportive sphincteric action. So leakage is there and sphincteric action is not good. Something is falling outside, piles is there. So these kind of things can happen due to the weak pelvic floor muscles. Stability is not maintained, back health issues are going on. So this can be the issue. So whenever muscles are weak, you might have heard that we need to go for Kegel. And whenever muscles are very tight, so you understand that we should not go for Kegel. So we have to stop Kegel. Instead of doing Kegel, we need to focus on something which can relax the pelvic floor. It means instead of creating contraction, we should focus on to relaxation. So reverse the Kegel. So Kegel and reverse Kegel are two different terms. Kegels means do these exercises whenever your muscles are weak, Kegels, and do reverse the Kegel when your muscles are tight. It means don't do Kegel, to reverse whatever, relax, don't do squeezing. Instead of that, do relaxation. So you might have about heard about that reverse Kegel word as well into pelvic floor rehabilitation for restoring the better functioning and wellness in a people's life so far. And yes, I have given you a brief about the importance of pelvic floor muscles. You can see that these are the muscles, how they are doing this stability of this pelvic bone. They have this kind of opening, so through that urethra, vagina, and anus is passing. These muscles are working as a base, so they're providing the support to the organs because organs is lying into that. You can see these muscles are not only the muscles of a female, the same muscles are present in a male also, but some muscles orientation is different as per their organs, which is different in a male or female. So posteriorly anal muscles are absolutely same, but the anterior muscles around that are different according to the presence of two opening in a female body. We have three organs in a female body anteriorly. We have clitoris, so there are muscles which is supporting that sexual functioning. We have this urethra muscles which is supporting this urethra separately, then muscles which is supporting the vagina separately. But in male, all these functioning, sexual bladder as well as the sexual bladder, they are maintained by that one organ, penis. So muscles are somewhere. Some muscles are less in female in male actually as compared to female, because female has three openings, so there should be three parts supporting, but in male we have one organ is doing the functioning, so muscles is less into number. So this is that yeah, orientation is somewhere different in male and female, but yes, muscles are present and they are doing the same functioning. Okay, and these are the how the organs are placed and how their canals are passing and how these muscles are supporting. They are working as a supporter or sphincteric action, and stability is very important, and which is bowel, bladder, sexual, that's functioning. So this is a support, stability, sphincteric, sexual, circulation. So muscles should be, those muscles are good who can contract whenever we want to let them contract. I want you to create a contraction of the pelvic floor. So you should be able to understand what the pelvic floor, where they are present and how to contract them. Okay, and that is very important. So muscles which can contract, I want to hold my urine, so they are supporting me. I want to hold my gas, they are supporting me. I want to hold my feces, they are supporting me. I want to hold anything inside my vagina, so they are supporting it. So these muscles which is creating a good contractions are good muscles. Now they are active at the right time. Now active means they should have that kind of trampoline effect, that kind of reflexes coming in, so which can support me during any sudden activity inside my, whenever any activity increasing intra abdominal pressure. So we have abdominal area, so whenever any holding of breath is going on or any pressure is getting built up into the abdomen, so that pressure is going to go downward as per the downward descent of that abdominal pressure, isn't it? That can put pressure over the organs, and organs can, that can put pressure over the pelvic floor. So at that circumstances, whenever intra abdominal pressure is raised, our muscle should not go for descending down, it should go ascending upward as a trampoline effect. So we want that kind of strong supporting muscles which can be active at the time whenever I am jumping, whenever I am coughing, I'm sneezing, I'm doing exercise, I'm lifting something. So all these activities, I should not voluntarily be able to, will try to squeeze my muscles. My muscle has that reflexes that they will definitely go for squeezing whenever this kind of action will be performed. So those muscles which is active at the right time. What is the right time? Right time when I'm lifting, when I'm pushing, when I'm loading myself, when I'm holding my breath, when I'm sneezing, when I'm coughing. So that is a, or when I'm doing my sexual activity, the orgasmic activities. So whenever orgasm is happening, so you cannot control your orgasm. Orgasm is a reflexive activity from the brain depending upon the stimulation. So that is also very important. That kind of reflex should come, and the muscle should keep giving you that kind of squeezing. So they are active during the sexual activities also. Or the muscles are good when they relax completely. I'm defecating, so my muscles should not have the tension. Which muscles? Muscles around the anus. They should not be tensed. The puborectalis muscle, external anal sphincteric muscles, or all the muscles which is present posteriorly towards my anorectal region. Those muscles should not be tight. And muscles around the back, which is pulling my like which is maintaining my sacrum angle, which is maintaining my coccyx. So those muscles should not be tight, the coccygeal muscle. So they should be always relaxed. So I should not have all the time back pain. But the back pain can be due to the tight pelvic floor muscles around the sacrum, which is all related to the sacrum and the coccyx. And the same way, my muscles should be relaxed when I'm defecating, I'm doing sexual penetration, or I'm doing any insertion of the tampon, or any insertion inside the vagina, or I'm having my sexual activities, or my urination or defecation. So muscles should not have any tension. It should be relaxed completely. So those muscles which do those functions, they are the good muscles. Now, what is the dysfunction of the pelvic floor? As I told you, too much tightness can give you hypertonus dysfunction. The muscles are very tight. It can be muscles tight around the urethra, muscles tight around the vagina, muscles tight around the penile body, muscles tight around the anus, muscle tight around the coccyx or that sacrum. So that can give you hyper, too much, like kind of something ascending. All the things is congestion. Something is upward. So you will fail to relax. So defecation problem, urination problem, penetration problem. So that can be one issue related to the hypertonus pelvic floor. And if your muscles, it means we need a good tone into that muscle. Like as you all understand that pelvic floor muscle has a 70% slow twitch muscle fiber, 30% fast twitch muscle fiber. So there is some slow twitch action throughout the day, stability throughout the day, support. So this is important. Throughout the day, endurance is the requirement of these muscles. So it can work against the gravity and it can help in supporting the organs, isn't it? So we want the good tone. So muscles should have a good firm tone. We don't want these muscles to go for hypertonus, the tone is hyper, or we don't want these muscles to lose the tone also, that there is no tone at all, hypo. So these are the dysfunction of the pelvic floor, if you understand. Now, if I'll take you to today's session. So this was the like kind of no understanding of pelvic floor for all the people who were new in my session today. But now let's come to the importance which every one of us, even me, you, everyone should be understanding if you are working from the last 10, 12 years, or if you are just working from last 1 year, or you are very new. So if you write down that for pelvic floor dysfunction, okay, yeah, Kegel exercise, or let me just, I have just taken some screenshots actually. Okay, so these are all the screenshots from the Google. You can also do that. And now, today we want to clear so many myths which is going on. So you might have heard that pelvic floor dysfunction. Okay, so for pelvic floor dysfunction, which exercises we are aware about so far? If you have not done the training in pelvic floor, so might be the Kegel is one word which you are aware about. Okay, so now what is Kegel? So Kegel is a effective exercise for pelvic floor. The whole world is knowing it. So Kegel exercises are important for pelvic floor dysfunction. If you just write down this word into the Google search, the answer will come. Yes, Kegel exercises are important for pelvic floor dysfunctions because they strengthen the pelvic floor muscles that support the bladder, rectum, uterus, helping to prevent and treat symptoms like urine incontinence and bowel control issue. Now, Kegel exercises are important for pelvic floor dysfunction. So it is very important to understand that what type of pelvic floor dysfunction you are talking about. If your pelvic floor dysfunction is hypotonus, you have a weak pelvic floor. So definitely Kegel is good to go because you have weakness. Because what is Kegel actually? If you say what is Kegel, so Kegel exercises strengthen the pelvic floor muscles by contracting and relaxing the muscles used to stop the flow. It is a command actually which is we are giving, that try to squeeze your pelvic floor, try to stop your urine, try to hold your gas. So now how to do the Kegel exercise? Like how to perform the Kegel exercise? Lie down with the empty bladder, tighten your pelvic floor. So tighten your pelvic floor for 3 to 5 seconds, hold and then relax. perform 10 repetition. It is the set which is given, that not only 3 to 5. 3 to 5 is nowadays because of so much of awareness, but if you go for last decade ago, so it was squeeze the pelvic floor, hold that for 10 seconds, repeat it for 10 times and perform 3 times a day. Can you understand? So squeeze your pelvic floor, hold it for 10 seconds and repeat 10 times and perform 3 times a day. If this is the Kegel exercise, and then they are saying the Kegel exercise are important for pelvic floor dysfunction. So now, if the person who is having hypertonus pelvic floor and that person will do Kegel, what will happen? So is it good for the doing the Kegel for that person who is having tight pelvic floor? The answer is no, because muscles are already tight. We don't know their status. They fail to relax. When they have spasm, they have shortening, they have tension, they have tightness. Why to create squeezing? In creating that kind of squeeze will worsen the situation. So that is now giving, that is ruling out very important thing, that Kegel exercises are not for hypertonus pelvic floor dysfunction. Yes, most of you are aware about this fact. Okay, so what is new into that? There is something ahead which I'm going to add. Okay, so this is completely ruling out that we should not give Kegel if the patient is having tightness into the pelvic floor. Hypertonus pelvic floor means any pain during urination, any difficulty in passing urine, any difficulty passing stool, any difficulty inserting inside the vagina, any sexual pain. Whenever difficulty, pain, that word come, so we should not give Kegel to that cases. Yes, it is completely clear. So now it is ruling out that, okay, so in which case we should do Kegel? We should give Kegel. So yeah, we should give Kegel when the muscles are weak. Clear? Am I clear to all of you? Yes.
Yeah, ma'am, it's clear.
Okay, so it's clear. So we should not do in that one too tight muscles, but we can now, let's understand, can we do Kegel exercise in hypotonus pelvic floor dysfunction? Okay, so now pelvic floor muscles are weak or they are not weak. Who is going to decide that? That we are going to, as a pelvic rehab therapist, first we need to take the history from the patient, and after that we need to go through the signs and symptoms, bladder, bowel, and sexual health, and after that we need to go for assessment. So we need to first, instead of, like, if you have some kind of issues going on, if I'll tell you, okay, you have urine leakage, okay, do Kegel exercise. Urine leakage means muscles. What does it mean? Urine leakage might be that her muscles are not strong enough, that's why leakage is going outside. Okay, so that's the urine leakage, because sphincteric action of these muscles are weak. Stool leakage, so yes, we should go for pelvic floor muscles. So urine leakage, stool leakage. So now again, if I'll tell you urine leakage, so but urine leakage is again can be different types. So we need to understand what type of urine leakage it is. So if you just broadly, if you go on a Google search, you will find out that there are three types of leakage, urinary incontinence. There's a three types of urinary incontinence, which is a term of blood, which is affecting the bladder health. You might heard about stress incontinence, you might heard about urge incontinence, you might heard about overflow. So what is this stress, urge and overflow? They are very important to understand for all of us as a pelvic rehab therapist, as a physiotherapist. What is the symptom of your patient? If your patient is telling you that whenever I'm doing sneezing, coughing, so sneezing coughing is increasing the stress inside the abdominal area. It means it is increasing the intra-abdominal pressure. So any activity which is increasing intra-abdominal pressure will definitely going to put stress over the organs. It can be all the organs. So that stress is going to push the organ down, means that is going to create a squeezing. Going to assume that this bladder is like a balloon. So if you squeeze the bladder downward, you squeeze this kind of what we say balloon, so you can understand downward pressure will increase. So if the downward pressure is increasing, if these muscles during this stress, downward pressure, so whatever content is there, means urine is there, the liquid will go downward, it will ascend down. So during this ascending down, now we have this urethra, and around the urethra itself, we are calling it the internal sphincter. Urethra is creating one pressure, and same way we are calling it the internal sphincteric pressure. So it means urethra is weak. So the tone of urethra is not there. The sphincteric action of the urethra itself is not good, and that relaxes. And same way, so urethra is also weak, as well as that muscles around that urethra, pelvic floor muscle, we are calling it as the urethral sphincteric muscle. Those are part of skeletal muscles. They are also not creating the contraction, trampoline effect. If the muscles are strong during the stress, they will create a trampoline effect. Urine will not come out. But if the muscles, they don't have tone, so they will open up, relax. Their fibers are not strong enough. They don't have that much of endurance. In this case, the trampoline effect is missing. So that can affect that your due to this stress which is happening onto that area during pushing, sneezing, jumping, laughing, coughing, that can push the bladder, squeeze the bladder, and bladder can squeeze the urine downward, and urine can come outside because the squeezing effect from your pelvic floor muscle is missing. If that is the situation, so if you, the first question which we have to ask our patient is, are you leaking during urine, during sneezing, coughing, laughing, all these stressful activities? If the answer is yes, it is telling us, oh, there are chances that her or his pelvic floor muscles are weak, okay, or internal sphincteric action is weak. Still, if the urethra tone is not good, but still, if your muscles are good, like after menopause, you can understand estrogen effect. So, urethra tone is directly somewhere depending upon the level of estrogen around the urethra. If the estrogen is not there, you can understand the urethral tone might be somewhere get hampered. But still, if the muscles are strong, female will not have urine leakage. But if the tone is weak, urethral tone is not good, and the muscles are also weak, so what will happen in this case? Urine will come out. And now another thing is, suddenly during this stress, urine can come out. So in this case, we can understand, yes, can we do Kegel here in this case? Because pelvic floor muscles are not strong, they are weak, they cannot do their sphincteric and closing action. So can we go for Kegel exercise? What do you think? Please write down in the chat box.
Yes,
Okay.
ma'am.
Yes, we can go for Kegel exercise in this case. Okay. Now, another case, the patient is saying that I have sudden urge to urinate. Suddenly I was just passing, I was crossing the toilet, and there was a sudden urge. I was just hearing the sound of water. I was having a sudden urge. So, sudden urge. So, when we say that sudden urge, so urgency of urinate. So urgency is suddenly created. Why? Because there was some stimulus. There might be some signs, some signboard, toilet was written, there might be break time, there might be you are free at home, the water sound, something is stimulating your what? Nerves. So nerves which creating that bladder. So this is not creating your muscles to get relaxed and contract. Urge means your bladder, the muscles which is around the bladder, the detrusor muscle, the middle layer of the bladder, that get sudden contraction. So when this detrusor, which is the organ itself, that is squeezing, so and then due to that the pressure is increased, and then you are having leakage. So this urgency, like I have an urge to urinate. So urgency means neurogenic bladder. Patient is have the bladder itself, the nerves which supply the bladder, they are not functional. So now when the bladder, if I'm saying, then the second question comes here, that do you have urgency only, but you can maintain the urge and you can go to the washroom, and then but you don't have urine leakage going on. I have a urge, I'll just control it, I'll go to washroom, I'll sit down on that toilet seat, and then I'm passing my urine. So my frequency of urination is very high because of this urgency. So I go again and again to the toilet because suddenly urge is coming out. The second question, are you leaking on the way of washroom? If the patient is not leaking on the way of washroom, it means the urgency is there, which is triggered by this detrusor muscle, but the pelvic floor muscles might be Strong. That's why muscles are, whenever this downward pressure is going on due to the squeezing of the detrusor, muscles are strong enough to hold that urethra, and she's maintaining the way of washroom. So in this case, when she can maintain going to way of the washroom, only urgency is there. So we should go for Kegel exercise. Think about it. When urgency is there, but you can maintain, you're not leaking on the way of washroom. You are maintaining that hold. So we should go for Kegel exercise in this case.
No, ma'am.
No. Okay. So, no. Okay. Same way, if the patient is telling you, I cannot, I have urgency and on the way of washroom, I leak. It means the patient is suffering from two dysfunction. Her detrusor muscle is also contracting. So nerves which is supplying that is also overactive. And the same way, the pelvic floor muscles are also weak. So when urine urgency and leakage is also a part on the way of washroom, then only we have to go for two. So only doing exercise, Kegel exercise will help the patient. Yes or no? In this urgency, if urgency is a symptom, only doing Kegel exercise will help the patient. No. Okay, we have to stimulate the nerves, relax the nerves, and we have to strengthen the pelvic floor both. So only focusing on the pelvic floor muscle, that oh, if you are suffering from urinary leakage, go for pelvic floor muscle, go for a Kegel exercise. So no, don't go for Kegel exercise if you have only urge symptom. Yes, there might be, you can go for Kegel exercise if you found the stress is there, stress leakage is there, or if you found the urgency with leakage is going on. Yeah, we can think, yes, in that case we can count on Kegel. But will the Kegel will be 100% effective in this case, urgency with leakage? The answer is again no. It will not be able to treat that overactivity of the detrusor muscle. You need neurological treatment in this case. Now, third case, you will find out the type of urinary incontinence, overflow. Overflow means that something, your bladder is getting fill, and it is not coming outside. It means urethra somewhere is obstructed, outlet is obstructed. You are not able to pass out the urine. Okay, it is not coming out. Dripping of the urine is going on, or you are taking a lot of time in urination. You are spending 30 minutes, 20 minutes, 5 minutes, 10 minutes. Urination is a activity of fractions. Within 20 to 30 seconds, we should be urinating completely. And but if you are taking long time, 2 minutes, 3 minutes, 5 minutes, 10 minutes, and you're not, no, you are still dribbling is happening, going on. So this way, can we go for pelvic Kegel exercise here? What the Kegel do? Squeezing. So is in this case, when this obstruction is into the outlet, and due to this obstruction urine is keep filling into my bladder, and due to this my bladder is overflow, already hyper expanded. So shall we go for Kegel exercise here?
No.
No, it will not affect. So now, when we say that types of urine incontinence, there are three types. Not only three types, there are so many types of incontinence actually. But we can understand that detail, some other day during webinars and workshops. But understand that now, if you write down on the Google, Kegel exercises are effective for urine leakage, or so the answer is written yes. Kegel exercises are effective for treating and preventing urine leakage. Is, is
गुलाबजामुन शेअर नाही टाकले.
Please mute
हो ना.
yourself. Mute
तुम्हाला
yourself.
बडबडी आज आली नाही.
Girls, mute yourself, please. Thank you. So you understand that no, don't just urine leakage is there. Okay, go for Kegel exercise. Again, it is wrong. You please try to take detailed history. Go for symptomatic treatment. If urgency is there, different treatment will be there. Urgency with leakage is there, different treatment will be there. And if only stress incontinence is there, then yes, we can think about the Kegel exercise. Squeeze your pelvic floor, and that is going to help you. Understood? I hope you understood. Same way, another thing, that how do I know that if my patient is having uh, this stress incontinence? So how to assess? Is it only just one symptoms leakage? This verbally your patient is telling you that I'm suffering from urine leakage and I have this during sneezing, coughing. So we'll tell them, okay, start Kegel exercise. We might tell them now start Kegel exercise as per what is written into the books, what is written into that everywhere. So what is that? Hold your pelvic floor, squeeze it for 3 to 5 seconds, and then repeat it for 10 times. This is what is the leftover, isn't it? How to do Kegel in case of stress incontinence? So means that squeeze it, squeeze the pelvic floor, hold it for 3 to 5 seconds or 10 seconds, and then repeat it. This is what we are doing it, isn't it? But very important, if as per the standard test which is we are performing, again you can write down on the Google pelvic floor assessment scales. We can, like, no, same way we have MMT scale, isn't it, for that muscle testing, for our just testing the strength of our muscles, whole body. Same way, Oxford MMT they have modified in pelvic floor. You can check the strength of pelvic floor by using Oxford MMT. And after that there's this scale is by Laycock, and the second is one scale is already there, perfect scale. You can also use these two scales, and according to these two scales you can tell your patient that, oh, you have a weak pelvic floor and do Kegel, isn't it? Because you're going to do that. If you found, so what is this pelvic floor assessment scale? So you will find this is what I written on that I wrote on the Google, and there were so many different variations came up in front of me, and then I just selected which is very easy, so you can understand in combination of both. So pelvic floor muscle functioning, because I know my patient is suffering from stress leakage, and it might be prolapse she's having, it might be some she don't have a sexual sensation, she have a saggy vaginal laxity, so many, like, no, hypotonus pelvic floor, isn't it? Because in case of hypotonus pelvic floor only we are thinking about the Kegel exercise. So if you are thinking about the Kegel exercise, so my recommendation to you, please check the symptoms, and after checking the symptom, if the symptom comes stress or that mixed where the urgent stress both symptoms are there, the second is you please go for a pelvic floor muscle function and strength checking by using any scales which is available in the books. So the scale which is available is, which is commonly used across the world by all the pelvic rehab therapists, is a modified Oxford grading system. The same way 0, 1, 2, 3, 4, 5, the scale is getting differentiated, and you can it is arranged. Zero means, if I'll just read this out, so try to understand what is written here. Zero means no contraction. No contraction of what? Pelvic floor. One means flicker contraction of pelvic floor. Two means weak squeeze, no lift. Weak squeeze from the pelvic floor. Patient is trying to squeeze, but there is no squeeze and lifting is going on, or very weak squeeze is going on. Three, fair squeeze with good lift. Four, good squeeze with good lift. Five, strong squeeze with the lift. So this is what is written, and you can go in more detail because it is all you will find it in the Google and the books also. Okay, so check the pelvic floor muscle strength first. So now how to check? What you have to do for that? You have to insert your finger inside the orifice. If she's a female patient, you can check by inserting your finger in vagina or anus. There are two openings because muscles are around the vagina, around the anus both. So insertion inside the vagina, transvaginal insertion or transrectal insertion. So during that insertion, you insert your one finger and then you give your patient command, okay, squeeze your pelvic floor. And whenever they are squeezing your pelvic floor, and then you can check if there is no contraction, flicker contraction, weak squeeze, no lift, fair squeeze, definite lift. Now tell me here, if you're inserting your finger inside, so, and if your patient is not showing you any contraction, your patient is either zero, either one, either two. So, can you go for Kegel? If your finger is inside, you are giving command to your patient, squeeze my finger, but there is no contraction being felt. So, can your patient Can you give that Kegel guidelines? The squeeze for 3 seconds, hold for 3 seconds, hold for 3 seconds. Sorry, squeeze and hold for 3 seconds and repeat 10 times. If there
No,
is no,
ma'am. I can't able to do.
yeah, why? Because there is no proprioception. Patient don't know what they have to do because muscles are not active. They are inactive muscles. So in this case, when there is no feeling of the finger, examiner finger, it can be one finger, two finger, three finger. No, I can't feel. So that in these cases, when the patient don't know what to do and you are giving them the Kegel squeeze because you have weakness, weak pelvic floor, so squeeze your pelvic floor. Do Kegel exercise. So yes, definitely the answer is right. You cannot give Kegel to the patient. If you'll give her, teach her Kegel also, she will not ended up in doing the right contraction, right activation of the muscles because muscles are not active. She will keep doing the squeeze from glutes, adductors, abdominals. That will start getting overactive, and the muscles will keep going on underactive because muscle is already underactive. Muscles they don't have any action. When they don't have any action, so what they have to do squeezing, how they will lift, isn't it? So this is very important. Check your patient. If that there is no action, no contraction, no Kegel will fail completely. Even in flicker contraction, if the flicker contraction, but she will be not able to maintain it, isn't it? Because how she, if she has a flicker, squeeze, relax, squeeze, there's no hold. So when this flicker is going on, so how she will hold for even 3 seconds? She can't hold for even 3 seconds. And we are saying that hold for 10 seconds. No, she can't do it. She has a flicker action. So in case of one also, she will not be able to do Kegel. So you can understand. Zero, one. Now two, when she have a weak squeeze, now squeeze is coming out from some part of the vaginal muscle, some part of around the anal muscles. Can she go for Kegel? There's no complete squeeze. So when there's no complete squeeze, she might keep doing action. Activation is going on. She's activating it, but you cannot increase the endurance. What is endurance? Hold it for 3 seconds, hold it for 4 seconds, hold it for 5 seconds. Holding it for some specific period of time is the endurance. But endurance is only possible when muscle has a strength, when the muscle has a power of squeeze. When muscle don't have a power of complete squeeze, can you work on endurance? The answer is no. So zero, one, two, definitely we cannot go for Kegel. Okay, and this is only the patient when they come to us. They are severe cases. Otherwise, they try to, when they have a fair squeeze, sometime leakage is going on. They don't come out. They don't speak out. They try to manage at home by themselves. So when the condition is not worsen, they are trying to manage, and when it will be worsen, then they will come to us. When at the time when they will come to us, they might have 1 0, might be the prolapse is going on. 0 1 2, that kind of cases are coming to us even at the age of premenopause, postmenopause, that age also. So you can understand that age, that much of weakness, and there's no action as per the MMT scale also. So will the Kegel work here if you are guiding them Kegel? Answer me. Anyone of you? No, we
No,
cannot.
ma'am.
Yes, we can't give them Kegel exercise because Kegel means squeeze and hold for certain time. This patient who have flicker, weak, no squeeze, it means they will not be able to perform that action. So Kegel is not for 0 1 2. From where we can start Kegel? If the patient has a fair squeeze, she can give lifting, she can show you lifting on your finger. Then yes, then we can tell, oh yeah, you have a lift. Now try to hold this lift for whatever your capacity is. It might be 2 seconds, it might be 3 seconds, it might be 4 seconds, it might be 5 seconds, up to 10 seconds. And then when she has that kind of capacity of creating that endurance, squeezing means endurance, then only we can say, oh yeah, you can squeeze for 3 seconds, now relax, can you repeat it? Then after endurance we can go for repetition. It means the perfect scale testing. Power, endurance, repetition, that can come, PER, that can only be done on those cases after 3 plus, where there is a fair squeeze is going on. Otherwise, you cannot go for even perfect squeezing testing. Also, at that scale testing, also, if the patient is 0, 1, and 2, you can't go for perfect, the second scale assessment. So, very, very, very important to understand that depth of the pelvic floor before you prescribe something to your patient. Okay, that's why 98.7% people who do Kegel, there's no response, there's no result. That's why Kegel fails. Now you understand how many patients are doing Kegel and the result is not there. 98.7% cases, the result is not there. Why? Because 98.7 people, their pelvic floor muscle is either 0, 1, or 2. When this muscle status is like this, the therapist who is giving, the doctor who is giving them Kegel, the doctor himself is wrong. How I can give you Kegel if you don't have any action in your muscles? So I need to stimulate your muscles first. I need to create action in your muscle first. I need to make them creating that coordination according to the need. So re-education, understanding, isolation, everything is very important. So that is where I tell all of you that stop Kegel if without checking your patient pelvic floor muscle strength. First, check it. And if you found this is 3 out of 5, fair squeeze with definite lift. Squeezing is also there and lift is also there. It can be on 1 finger, 2 finger, or 3 finger, doesn't matter. But squeezing you can feel. So then we can say, yeah, squeeze is there. You can do Kegel and perform it 3 seconds, and slowly, slowly you can go for a progression. But stop Kegel giving that if your patient has 0, no contraction, flicker contraction, and weak squeeze. Okay. So this was my webinar for today, and I hope you can understand. And definitely, we have to stop Kegel in hypotonus activities. So now, if I tell you that this statement, Kegel exercise strengthen the pelvic floor muscles by contracting, relaxing the muscles, so this again is not good for all the, as per the assessment programs. 0, 1, 2 will not work in those cases. And yes, we should definitely stop it. And I would request you to please take a screenshot of this scale, because we are always concentrating on the scale of uh, checking the power of our muscles. Our mind is always busy how much powerful this muscle is. It can be the biceps, triceps, or same way the pelvic floor, how strong the pelvic floor. So to check the power of pelvic floor, there's one scale, modified Oxford grading scale. But pelvic floor muscles, you cannot check the power of pelvic floor if you can't insert your finger inside the vagina, isn't it? So it is very important to check the relaxation scale in case of uh, pelvic floor, isn't it? Because if the scale is telling you insert your finger and then ask your patient and then check the strength, but if you can't insert your finger, then what is the treatment for that case? So so you will not go for assessment. No, assessment is required. In this case, there might be patient is having tightness means the muscles around that will be tight. So this is how, this is the scale, digital pelvic muscle testing scale, which is designed by me, and I'm using this scale since many years. And please take a screenshot, and your patient can be -1, -2, -3, -4, -5. -1 means patient is not ready for perineal assessment or finger testing or touch. Patient will not give you consent that, okay, I'm ready for my assessment. Patient is telling you, no, I don't want to go for assessment. There might be patient is feeling fear of touch, or it can be shy. Patient is shy. Whenever your patient is not letting you to touch the perineum, and they're not ready for assessment, that kind of patient we are calling, we cannot go for assessment in those cases. So at that case, we have to do external assessment and treat externally as much as possible, and give them education. Physiological and psychological involvement is very important in this case, counseling and the treatment. If your patient is having -2, means the patient is ready for the assessment. They have signed the consent form. She's lying down on the on that couch, even he's lying down on the couch. But the moment you start touching superficially over that vulva, externally perineum, anus, still their area is painful. So in this case, we are calling the muscles around that area are tight, hypertensive pelvic floor. Superficial layer is tight. So when externally tension, palpation is giving them pain, so can you insert your finger inside the vagina? The answer is no. Can you insert your finger inside that anus? The answer is no, because external touch is only painful. So the treatment will be according to that. Patient will be termed as a -2. Hypertensive pelvic floor, tensed superficial muscles. Patient is ready for penile assessment, finger testing, but very painful touch around the orifice. The answer that message is that you cannot penetrate in this case. External pain is there. The treatment will be accordingly. Same way, -3, patient is ready. You are touching the vulva. There is no pain around penile body, no pain, and anyway, there is no pain superficially. The moment you start inserting your finger inside the vagina, then the pain starts. So pain is there in insertion. So insertion is difficult, insertion is painful, she has discomfort penetration, so different kind of patient is not relaxed with this insertion, and she's showing you like, oh, it is painful, so tight orifice, discomfort, painful penetration, she is doing the hip lifting, adductor squeeze during that time. So might be the superficial muscles are relaxed, but the muscles, deeper muscles around the vagina, the middle layer or the deeper layer, they might be tight. That's why you cannot go for penetration. So in this way, you have to go for a dilation therapies. The treatment will be different. -4, the partial tensed pelvic floor. Patient is ready. You are inserting your finger inside the vagina, orifice, anus. There is no pain. The moment you start touching inside any organ, or it can be any deeper layer of pelvic floor, deep levator ani. So that muscle has some kind of spasm, internal spasm is present, levator ani spasm, puborectus muscle tension, tightness. So means inner muscle, deeper muscle is having tension. So that patient, pain after penetration, pain after sexual activity, pain during sexual activity. So that kind of question, that kind of symptoms patient will tell you. So in this case, patient don't have pain during penetration or during the touch. She has a pain after the penetration, during the sexual thirsting, after having the sex, after having a defecation. So that is the cases where deeper layer is tight. So this is the -4. And -5 is means you are inserting a finger inside the vagina, you are touching everything around the rectum, touching everything, all the organs, all the muscles, all the supportive structures, but there is no pain at all. That type of female is completely relaxed. So we are calling this -5 out of -5 is complete relaxed pelvic floor. So now in all these cases, can you give Kegel? Can you give Kegel exercise here? Write it down in the chat box. Now, after going inside the vagina, when there is no pain at all, or around the rectum when there is no pain at all, so we have already ruled out the relaxation scale is -5 out of -5. Then we will check that power of, so that was a power of relaxation of the pelvic floor. Now let me check, the muscles are completely relaxed. Now let me check the strength. Are they have any, what type of strength they are having? So for this 1 plus, 2 plus, 3 plus, 4 plus, 5 plus, you can use that MMT scale also, Oxford MMT, modified Oxford MMT, or you can use my scale also. My scale is more kind of clear and detailed. It will give you more understanding. So 1 plus means poor pelvic floor. Means mild, very mild, or no hold or flicker. There's no squeezing, kind of very weak muscles. Not able to hold your finger even by use of accessory muscles. She's doing everything, but still there's no action you are feeling as a therapist on the female orifice. Like you can understand there's a
Is not clear.
pelvic area is like a clock. Okay, 1 2 3 4 5. Use the clock around the pelvic region. So all out of these 12 regions, there will be only one or two sides might be flicker, contraction will come, not complete 12 sides. So right, left, up or down, so there's no contractions going on. So this is kind of muscles are completely poor muscles. Weak muscles, when she's trying to create a contraction, from some sides might be 12 and 6 is squeezing, 3 and 9 is squeezing, 2 and 8 is squeezing, 10 and 5 is squeezing, 10 or 4 is squeezing, 11 and 5 is squeezing. Somewhere some muscles are active, some part right is active, left is not active. So some muscles are active, some are not active. In this case, we are calling those muscles as a weak muscles. Half of the muscles are inactive and half of the muscles are active. So those kind of muscles, which is half, they cannot give you complete squeezing of your finger. So no circumferential hold will be there on examiner finger. So again, these are the weak muscle, no circumferential hold. So third is patient will give you complete circumferential hold. So muscles are active right and left all way 1 2 3 4 5 6 7 8 9 10 11 everywhere muscles are active and you are giving her a command squeeze, so they are squeezing you, so they have a sensation also, so they can sense your finger, they can squeeze your finger, so those kind of, and right and left, right, good strength, and they can hold your finger. So in this case, good hold on examiner finger without use of accessory muscles, we are calling it as the voluntarily active muscles, because I gave you command by inserting my finger. Okay, can you feel my finger? Yes, now squeeze it. So then you are squeezing it, so voluntarily you are squeezing it and your muscles are active, they are giving that circumferential hold and I can feel it. 3 plus. 4 plus, I inserted my finger inside and suddenly your muscles sense that something is there and they did that reflexive action. So reflexive action without any command from the examiner, there was a strong circumferential hold on the finger of examiner finger. Means I didn't told you to squeeze me, hold me, and your muscles grab me. It means your muscles are involuntarily functional. There is a good reflexive action in your pelvic floor muscle. It is not only the muscle, even the nerves which supply the muscles, they are intact. So that is a very good muscles. 4 plus and 5 plus means you can squeeze my finger without any command, and even you can keep holding it for 10 seconds as per endurance. You can keep repeating it for 10 times, and even you can if I'll try to apply some, if you try to apply some kind of resistance, like if I tell you to sneeze and cough, still you will maintain that hold. And if I try to pull my finger out, I'll give you resistance, still you can grab my finger inside. If that kind of things are there, so we call it as a 5 plus, very strong pelvic floor muscles. So my request is please take a screenshot of this scale and you can use it as well if you are and you can also use modified Oxford, it is all up to you. So
That slide is not seen, ma'am,
slide is not seen.
from long time.
Oh, I'm so sorry, I thought it is there. I'm so sorry, I thought the screen is there. Okay, is it visible now?
No, no,
Yes.
not yet, ma'am.
Yeah.
Now.
Yeah. Okay, so now let me give you. Oh God. Stop sharing. No, I have opened the wrong one for you. Share screen, window, and this one. Now can you see? Visible?
Yeah, ma'am.
Something else, yes. The Google
Okay.
screen is there.
Yeah. You can
Now.
check. You can please take a screenshot of this screen scale for relaxation and take a screenshot and scale for contraction. So these are the two important scale, and according to that, you have to decide you should give Kegel to a patient or not. So in all these cases, minus one, minus two, minus three, minus four, you cannot give Kegel. Stop Kegel. Okay. Even 1 plus, 2 plus, you can Kegel will not be effective. So stop Kegel. You need detailed assessment of your patient, and detailed therapy is required. Kegel will not be helpful, and your patient will be again going to tell you and tell society that I've been to this doctor and she told me to give Kegel, and I keep doing it since last 2 months, and but it is not working. Definitely it will not work if it's 1 plus and 2 plus. Understood, all of you? So that was my session of the day. And do not believe on what the Google tells you, and even the books. It is very important to understand the depth of your pelvic floor. And a lot of people, I know the pelvic floor dysfunctions are not life threatening, but it affects people's quality of life. If someone is leaking, someone is not having good sexual activities, they have a prolapse, they have a leakage of stool, they have a vaginismus, tight muscles, they can't have sex, they can't have penetration inside the vagina, it might affect their fertility. So, yes, it is affecting their quality of life, it is affecting the individual, it is affecting their relationships, it is affecting their social life. So many of women, they are not going out of the home home because they have this leakage going on, they have this urgency, suddenly they have this kind of triggering factors, the moment they can't hold outside. So it is affecting the people's quality of life. So it is very important that we should understand the right pelvic floor, and let's add this rehab in our practice and start giving them the complete care by treating their these issue in pelvic floor issue also. Very, very, very important. All right. And thank you so much everyone for joining me today. I hope that you am I can you see me? Am I visible?
Yes, ma'am.
Yeah.
Okay, lovely.
Yes, ma'am.
So I hope that you learned
Ma'am,
something.
I have a little bit doubt. So what should be done in grade 1 and 2? In that we cannot give the Kegel exercise, no?
Yeah, you
So what?
cannot give the, you need, this patient requires stimulation. So what you have to do, that re-education, first you educate the person about this by giving the brain education, that these are the muscles, these are the muscles. So education is a very important thing. Second is stimulation. So tactile biofeedback is important, because if these are the muscles, I'm inserting my finger, I'm telling you to squeeze, 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 but your muscles are weak, you can't squeeze, isn't it? So what I'll do, I'll touch right and left every point, one, two, three. I'll keep touching, keep moving my finger. Can you feel? Can you feel? Can you feel? Sensate focus therapy. So sensation, she should be able to feel that what I'm telling you to squeeze. So I will make you aware for that first. So in these cases, electrical stimulation, biofeedback devices, even nowadays you might have heard about that Ancella chair, Kegel chair. So many of doctors, they are putting that chair in their clinic and they are telling, oh, if you have a leakage issue, weak pelvic floor, this Ancella chair will help you. And that Ancella chair is working on a magnetic therapy and 11,000 contractions. So you can understand that this Ancella chair, if the patient is having zero power, one power, two power, if you put that patient which has a very weak muscles, inactive muscles, if that person will sit on that chair, what will happen to them? Fatigue. Okay, so that is not good at all. So for this, proprioception is very, very important, or electrical biofeedbacks. The transvaginal stimulators are available into the market, so those kind of things will be the first line of treatment. So once that this current will keep activating the nerve activation, so nerve stimulations. So pudendal nerve stimulation is the treatment for 1 plus and 2 plus, because muscles need that nerves. The nerves will be active. They will make the muscle to be active. So 1 plus 2, 0, 1 plus and 2 plus nerve stimulation is that first line of treatment. No Kegel. Okay. So uh, can you suggest any reference for this topic? Look, you can just go to, I don't know, how can I give you my reference to this topic? You understand that. That comes with the experience actually. When you treat your patient, you found that yes, they are not getting result. Why they are not getting result? Because they're not doing the right thing. They don't know that what they have to squeeze actually. And if you are giving that 0, 1, and 2, if they are giving them the Kegel exercise, that's why the statistics are showing 98.7% people who perform the Kegel. That statistics will found a lot of in the everywhere in the Google and research sites that Kegels are not effective. So when the Kegels are not effective, they who is doing Kegel? 1 plus and 2 plus. Then only the Kegels are not effective. If patient is 3 plus and she is doing Kegel, definitely it will be effective. Okay. All right. So all right. I hope that that session was okay for all of you, and you might have learned something. Thank you so much for joining me. You can keep following me on my Instagram page. I will send you the link. You can join me on workshop. We are coming up in Patna. We are coming up in for hands-on workshop in Patna schedule, Delhi schedule, Cochin is schedule, and then what Hyderabad is scheduled, and even online webinar is also scheduled. We are starting the online webinar every evening, 8 to 10:30. starting from 13th to 23rd. So it will be 10 days continuous learning program with 1 or 2 day off in between. Whenever we have a festival, 2 to 3 days festival, we will be off. Otherwise, it will be continue 2 to 3 hours of webinar, and I try to give you my level best education, and you will understand the depth of it, and it will help you in treating your patient who has pelvic floor weakness. It can be tension weak, or it can be the back health issues, coccydynia, piles, hemorrhoids, diastasis recti. They all are interrelated. So I'm going to catch all of these things. I'm going to cover all these things in my online webinar as well as in hands-on workshop. So if you cannot join the hands-on workshop, do join our online webinars. Thank you so much, everyone. I'll see you next whenever possible in life, and keep doing your level best. And I'm not saying the books are wrong. Books will give you a lot of new information, but more information, your practice, your experience will give you. Each of your patient will teach you new things. This is how I learned in my life, and learning is a continuous process. This is what I feel. Keep learning, keep sharing. This group will be open for next updates, and if you found something new, interesting, related to the women's health, related to the pelvic floor, please share that articles in the group so we all can learn together. Thank you so much.
Thank you, ma'am.
Thank you. And you can always keep asking the question in the group also. So, Dr. Leena, you are my Dr. Leena who has done the pelvic floor with me. Yeah? Or I don't know. Okay. Thank you so much. Thank you so much, everyone. Bye. Take care. Look after yourself. Love the person you see in the mirror. Okay? Smile always. Take care. Bye.
Thank you, ma'am. Bye.
Thank you, dear.